Hello, warriors. Hello, healers. Happy Friday. On the event of me recording this video, we are in the middle of our Black Friday or special promotion, I call it, for cold and flu, COVID, viral infections, immune boosting, energy, boosting energy, decreasing inflammation. And the special promotion entails you getting a high dose vitamin C for $220. It used to be $294. And an antiviral combo with glutathione for $210. Used to be $345. Because of this special promotion, we have been getting quite a few questions because I know that many of you guys are not familiar with IV vitamin therapy, and some of you might not comprehend why this therapy, like, it doesn't make sense, right? Like, it doesn't make sense. You're not swallowing a pill. It's a whole bunch of minerals and vitamins and nutrients going through your vein. You might not understand how is this going to help you. So I want to take a few minutes to discuss why I'm in love with IV vitamin therapy, why that is something I will forever do. Even working at the emergency room, I see myself all the time, like infusing, what to infuse, like just the plain water, and seeing the difference in my patients, even with myself. So when you find something that works and it's no longer a secret. It used to be a secret. It used to be the celebrities and the stars. I remember seeing Rihanna after like a concert. She was on her page, or she was online with an IV. She was getting a Myers cocktail. And I'm like, wow, that's the reason why these people are looking so great, like beautiful skin. They can lose weight within days. They have tons of energy. And we know that this is not something we can get from our food, right? You have to eat a lot of food to really get the energy, the vitality, to really feed your body the nutrients that it needs your cells to work for you. We know our food is depleted. We know our food is contaminated. We already know there's so many things being injected into the soil. So IV vitamin therapy is an option if you cannot get the proper nutrients. Another reason why I highly recommend IV vitamin therapies for those of you that have gut issues. Many of us are not digesting food properly. We are not absorbing food properly, and we feel weak. We feel we have lack of energy. We have muscle weakness. So when you feed your body the nutrients like you could be getting from your food, remember those vitamins and minerals like vitamin C, B1, B2, B3. B5, B6, B9, B12. These are things you should be getting from your food. Vitamin C, you can get from your food, and then amino acids, you should also be getting that from your food. So if you're not digesting your food, you have gut infection, you have acid reflux, you have gas, you have bloat, you have colitis, you have Crohn's, you have inflammation, you have autoimmune, you have cancer. I assure you, you're not really getting the nutrients into your body. So IV vitamin therapy is something that I used to prescribe in the hospital when I used to work with a doctor that does a lot of feedings, like TPN and, like peg feeding. So we will, sit down and formulate a formulation and send that formulation to the pharmacy, and the pharmacy will send a bag of clear fluid that has protein and fats and stuff like that. So IV vitamin therapy, it's you getting the nutrients in your body. For all of you that cannot have gut issues, this is a perfect solution for you. And today, I'm going to share with you how this therapy can also help with viruses. The ingredients that we are formulated that I'm picking from the list of all the IVs and minerals and put it into that bag is going to help, right, with the viruses. But before I go over like the few key elements, the few key components, we have to be honest that people are getting sick. Like I'm telling you, this week alone, I have 5 patients reaching out to me, telling me that they got sick. The whole family got sick. They have cold, they coughing, they sneezing, they have sinus issue, they have low body aches, low grade fever, like the immune system is very weak. Anytime you have an infection, that goes back to you having poor immunity, my friend. That is your immune system not being up to par, like you are weak, like your immune system is weak. Anytime you have an infection, whether it's urinary tract infection, whether it's a yeast infection, viral infection, bacterial infection, ear infection, nose infection, like whatever, that means your immune system is not there. Your immune cells are not fighting for you. And yes, I am promoting these IVs for cold and flu and COVID, but these things will do whatever they need to do in your body to give you the solution, the results that you're looking for. Okay. So with the high-dose vitamin C, we all know high-dose vitamin C. Vitamin C is my favorite. I love vitamin C so much. So excited when I talk about vitamin C. And I choose and outsource the best vitamin C so that we don't have a lot of toxins and binders and fillers, right? It's preservative-free, high-quality vitamin C. That's why this high-dose vitamin C you cannot pass on. It's 220, and with the vitamin C, you get clear water. There's no minerals in the water, and you get vitamin C, a lot of vitamin C. Sometimes we start slow if this is your first time because safety is important to us, and then we ramp it up. So you get vitamin C, you get magnesium, calcium, and potassium because vitamin C is a chelator. If you take vitamin C by itself, you don't couple it with the other minerals, it's gonna pull out because it's gonna kill the toxins as well and feed your cell the nutrients. So that's that. You get that for 220 in this promotion. And then we have the antiviral. Now we have a few key things in the antiviral. The first one is the NAC, NAC. NAC is an amino acid. They are antioxidants. It is an antioxidant. It protects the kidney. It protects the liver. A lot of our viruses are housed in the kidney. In the liver. And then if the liver cannot process them, and then the kidney has to filter the shelves of the virus, okay? So you need to make sure your liver is being protected, your kidney is being protected. But NAC is really helps with immunity. It helps with immune boosting. We're finding out now for COVID, NAC is really good in bringing your smell and taste back, but you got to do a lot of NAC, okay? It's not just one. You got to do a lot for you to see those things coming back. And because with the antiviral, we're getting the Bs, all the Bs, B1, B2, B3, B5, B6, B12, and you're also getting the B complex. You're also getting magnesium, you're getting calcium, you're getting magnesium, calcium, you get a little bit of vitamin C, you get the NAC. We also coupling that with the glutathione. Okay, so glutathione, as you can see on the screen, probably not, but I'm going to read it to you. Glutathione is not something that I promote a lot. Glutathione, you can Google it. It is not something that I promote a lot because it is such a powerful antioxidant. It is called the mother of antioxidant. It is a tripeptide. It has 3 amino acids. It has glycine for the brain, cysteine, and also glutamine. So not only glutathione helps with DNA repair, with protein repair, it helps with metabolizing calcium, it helps with carcinogens like cancer, it helps with immune function, okay? It prevents your cells from dying. Glutathione also helps with liver detoxification, and it helps with aging. And it helps with eyes, age-related macular degeneration. It helps with lungs, okay? Glutathione helps with like a lot of gut issues. Can you believe that? So glutathione has a lot to do, a lot, but we use it the most. I usually reserve it for like my very difficult cases or my very tough cases. If you are one of my patients who've been to my practice, I don't just push glutathione on you. I never do. But when I'm fighting with the case and I cannot get the results, I'm like, okay, what am I missing? I am literally recommending glutathione. Okay, so this is you're looking at, I know you probably can see this if you're watching the video, but I'm going to have this video here on YouTube. You can go on YouTube if you want to see the slide, but you're looking at this portion that I have on glutathione. You can inhale it. You can also give it IV. Now, you might say, well, Dr. J, I can purchase glutathione supplements. It's not the same thing. Supplementation is not the same thing. You're not getting the same efficacy, same absorption with supplementing with glutathione. And glutathione, that is something that is so potent, it has to be refrigerated. All right. So you can see I use it. It's antioxidant. It's good for your heart. It is good for your brain, right? Central nervous system disorder like Parkinson is good for Parkinson, Alzheimer's disease. It's good for autism. It's good to move. It's good to move chemotoxic therapy toxicity. It's good to move like chemotherapy products out of your body, like chemo, medications, right? It's good for aging. It's good for to help repair injury. It's good for alcohol fatty liver disease, non-alcoholic fatty liver disease, right? It's good for the liver, and it's also good for viruses. So we're using it for asthma. You can use glutathione for asthma. You can also use glutathione for hepatitis. You can use glutathione for viruses. Now, in our practice, when you do the antiviral, you get the glutathione push at the end of it. Okay, so if glutathione can do all that, imagine getting so many pushes at the end, you are going to get the benefits. So that's what I was saying. And you can see here that it is very safe, right? Because I know there's a lot of questions about safety. We've been getting a lot of questions about safety. How is this? What is going to happen to me? Is it going to hurt? Am I going to die? Well, nobody said that. But what is the safety profile? IV vitamin therapy is very safe, my friend. It's very safe. In my practice, my IV vitamin therapy is very safe. We monitor you and we do not push things into your body. If Len or myself is having a hard time, we cannot get the needle in, we much rather not, lose. We much rather lose the IV, not have you pay for it so that we can make sure you are leaving our clinic safe. Okay. So you can see this. Yes, we don't give it to the children, right? We don't give I'm not a children doctor. Pregnancy, we don't give it to pregnancy. Although I had one pregnant patient, I had to give glutathione because a lot of viruses were coming up and she didn't want to take any medication. So we did it very slow and we diluted and we monitor every little tiny push. We stop. How you doing? She did well. We use it with caution with patients that are, mothers that are lactating. But again, you have to look at the dosage. You have to look at the practitioner that's doing it. You have to look at the facility because yes, there could be, I've heard of stories of patients going else in other clinic and then they had a terrible experience. For us, I've been doing IV vitamin therapy since 2011. It's a long time. So far, thank God, and I pray to the Lord, and I thank the Lord every single minute for not having a single issue. People walk into my clinic and they walk right out the same way they walked into my clinic. Now, they may have some detox reaction at the end because, again, I'm not in control of what people do at home. I can only control what happens in my clinic. So they might have some detox reaction, or maybe they're not drinking enough water, or maybe they're going back to eating the same food. I give them the same issues. And now, as this thing is working throughout in the bodies, it's pulling out toxins. They may have a little bit of sluggishness or tiredness, and that's it. Nobody ended up because of my IVs in the emergency room. Nope. IVs are preservative free. We really pay attention to where we outsource it. That is why it is in the pricier side, but I'm telling you, you're getting a lot for your value. And the other question I'm going to address, and I will continue to address, is that you cannot expect to do one drip and feel like amazing. It doesn't happen. It's one drip and we don't know what we are fighting with. We don't know what deficiencies you have, the severity and the degree of your nutritional deficiencies. We don't know what other inflammations you have brewing internally. So for all of you that's like looking into purchase one thing because it's $200 and something and expecting results, my friend, this is the wrong expectations. If that's the case, then we are not the practice for you because I will always tell you the truth. I don't want to give you the wrong expectations and then for you to come and be like, oh, I'm still coughing. I still have viruses. What's going on, Dr. J? One drip is never enough. Okay. So that's what I wanted to share with you because I know many of you guys have questions. You are interested, but you're not sure if this is worth it. Should you be investing in it? Yes. Even if it's not with me, if you have cold, flu, you're under the weather, you're not fighting that thing, that sucker, please get you some IV vitamin therapy. Try it out and make sure you are getting the formulation and the combo that will be the best thing for you. That's going to give you the results that you're looking for. Okay? All right, so that's all I have for you today. Now, the promotion ends Tuesday, November 21st at 4:30 p.m. We are leaving, we're going away for like Thanksgiving. And then you have until January to purchase your, to use all your drip. And again, the high dose vitamin C is 220. And the Antiviral with the glutathione push is 210. Oh my God, it's so amazing. I mean, you're getting so much for 210. Like I would literally bank on that. I will purchase as many as I can. And as I mentioned before, yes, vitamin C for 220, antiviral 210. Remember, the vitamin C used to be 294, and the antiviral used to be 345 with the glutathione push. You're getting that for 210. As I mentioned before, if you're interested, you don't know where you're going to get the money, I would manifest it if you believe in manifestation. But if it's something that you really, truly, truly want, it's going to help you because other things that you're trying are not giving you the results, right? And you want to try IV and you're going to purchase a few. Again, one is never the case. You're going to purchase a few. Then I will really look into the universe, look into your surrounding to see where you can get that money. Okay, because it is the best gift you'll give yourself this holiday season. The more you purchase, the better you'll feel, the more you saturate your cells. Okay, because again, with the IV, with the drip, we have to put so much so because we want to make sure the IV is compatible to your vein and you don't have any issues, any discomfort. And that's another question too. Patient asks, is it gonna hurt? It's a little pinch. It's like you go into LabCorp, course diagnostic, you get in a little needle infused, and that's all that is. A little pinch. There's nothing more to it. And the reason why we formulate we compile our formulation or we formulate our drip the way we do is because we don't want you to have any toxins that would irritate your the wall of your vein, and for you to have massive infection that can happen. And like swelling could happen and redness could happen. We don't do that, and we monitor the sites all day long as you are in our under care. And then we follow up with you, making sure you're okay. So safety is our number one concern. That's been taken care of. You just have to do your part, purchase, however infusions you can, and then leave the rest to us. Okay. So I can't wait to see you in our clinic. Again, the vitamin C is 220. Used to be 294. So you do the math. And the antiviral combo with glutathione is 210. Used to be 345. You do the math. Okay. So happy. Oh my God. All right. And IV vitamin therapy is good for all things. Good for hormones. Yes, it is. It's good for hormones. It's good for gut issues. Because why? You are feeding your cells the nutrients and they are going to help you make hormones. You're flushing your those toxins out of your body because remember, it's antioxidant, it helps with the liver. So therefore, you're gonna create more room, you're gonna decrease inflammation, create more room for your body to restore, so to create more hormones. I did IV vitamin therapy and I will continue to do that sucker until I die. I promise you. Because I see the benefit and I cannot afford to be sick. Okay. I cannot afford to have a weak immune system because people need me. You guys need me, right? And my job is to give you the information to show, to, make you see the light. And then if these things resonate with you, then you'll come and join me. All right. So you have a fantastic rest of your day and I'll see you in our clinic getting a drip.